Dispatch to a 55-year-old male having chest pain. BSI is on. Scene is safe. Nature of illness. Patient is having chest pain. I have one patient. I will request ALS backup and consider C-spine, even though I don't think it is necessary. My general impression of the patient is the patient is sitting down, holding his fist to his chest. As I walk up to the patient is alert. I say, my name's Armando. I'm here to take care of you today. I'll ask the patient's name, what day of the week it is, and where we are, and why he called 911. And he says he's called 911 because he's having chest pain. So his chief complaint is going to be chest pain. I don't see any other threatening injuries, so he's just having chest pain. So I'll check the patient's airway and breathing. His airway is clear since he is talking to me in full sentences. Check his ventilation. So it looks like he has equal rise and fall to his chest. I'll check his respiratory rate. And he's breathing 22 breaths per normal. So at this time, I would administer the patient 100% oxygen via non-rebreather mask at 15 liters per minute. I also check the patient's circulatory, so I'll check for his pulse, and his pulse is 110 regular. And at the same time I'm checking his pulse, I'm going to be checking his skin condition, which is pale, cool, and clammy. Since his condition is pale, cool, and clammy, we're going to treat the patient for shock, so we'll throw a blanket over the patient to keep him warm, and we're also treating him with oxygen. I don't see any major bleeding, so I don't need to control any major bleeding. This time I'll determine the patient as a high priority patient due to chest pain, and we'll prepare to transport the patient emergent. I ask the patient what was he doing when the pain started. He claims he was mowing his lawn. I say if the pain is getting worse or better. He says that it's getting worse. Ask him to describe the pain. He says that there's a pressure on his chest. He feels like something sitting on his chest. I'll say, does the pain go anywhere else besides his chest? He says that it goes to his left arm. I'll say on a scale of 1 to 10, 1 being the least pain he's ever felt, 10 being the worst pain he's ever felt. Ask him where he's at. He says that he's at a 7. And I'll ask him how long has he had the pain. He claims he's had it for 15 minutes. I'll also ask him if he's done anything to help the pain prior to us getting here. He says no, he just came and sat down. I'll also ask him if he has any other complaints at this time, and he says no, just his chest. And I'll also ask him if he feels any weakness, fatigue, or dizziness. He says that he feels a little tired, he feels a little weak. Ask him if he has any allergies, claims he doesn't. If he takes any medications, claims he doesn't. If he has any past medical history, claims he's had a minor heart attack in the past. The last time he ate or drank something, claims he ate breakfast. And I'll tell the patient just to confirm the events leading up to him having chest pain was him mowing his lawn. So at this time, since I took his history, I will inspect his affected body part. So since it's his chest, I'm going to check his cardiovascular system. So I'll look at his neck, determine if there's any JVD. I'll look at his feet and ankles to see if there's any systemic edema. I'll check his pedal pulses to check if there's circulation going to his lower extremities. Also check his other pulses, make sure he has circulation going to his upper extremities. And also check his skin too, which is still pale, cool, and clammy. And also check the patient's respiratory system, which I'll do it posteriorly. Do 6 different spots with my stethoscope, comparing left and right, and I've done that in his chest. His lungs are clear. I'll also check the patient's musculoskeletal system, so I'll open the patient's shirt up, inspect if there's any injuries or anything like that, and I will palpate his chest. At the same time I'm palpating his chest, I'm asking him if he feels any pain. He claims he doesn't. Also ask the patient if he has any problems going to the bathroom. Claims he doesn't. If he feels nauseous or if he's vomited, and he claims he hasn't vomited, but he does feel a little nauseous. So at this time I'll do a full set of vitals. So I'll start with his blood pressure. So I'll wrap their blood pressure cuff, put my stethoscope on, pump it up, get his systolic, and then I'll get his diastolic, and his blood pressure is 112/80. And at this time, I also check his pulse. So I ask if I can check his pulse, check it for a full minute. And his pulse is 110 regular. I also check his respiratory respiratory for rate, rhythm, and quality. And he is breathing 22 breaths normal. So at this time, my field impression of the patient is he's possibly suffering a heart attack. My interventions and treatment for this patient will be administering high flow oxygen. We'll transport the patient emergent and have him be in a comfortable position of his choice while on the stretcher. I'll reassess this patient every 5 minutes because he is potentially unstable. So we'll check his vitals every 5 minutes. We'll ask him questions just to check if his conscious level is still normal, and we'll check if there's any. We'll check the oxygen, make sure that there's nothing wrong with the receiving oxygen. Make sure there's no kinks or anything like that. And I will also give a full report to the arriving EMS unit or to the hospital of the treatment of what we found and what I have done to the patient. And that completes my assessment.